Hello. If you're one of the over 200 million people around this world who are suffering with an overactive, uncontrollable bladder and a bladder pain syndrome that may be called interstitial cystitis, you deserve to listen to this video. This gentleman that you're going to see in just a moment, his name is Bryan, a young man who came to my clinic. My name is Dr. Lonnie Herman. I'll talk more about my work in just a few minutes. But you're going to see from this man and hear from this man of the incredible reduction in the urge, in the frequency of the urge, in the bladder pain or bladder spasms that he's experienced in his first 2.5-month protocol, 3 months maybe at max, that he experienced the reduction and sustained reduction in these symptoms that have changed his life forever. His headaches, his brain fog, and even symptoms that he had in his fingers that you'll hear from him have been dramatically reduced, if not even totally eliminated. So let's listen to a bit of what Bryan has to say first, and once we come back from listening to what Bryan, a brief segment of what Bryan has to say, I'm going to share with you his exam findings and a very unique way of understanding what causes the overactive bladder, the interstitial cystitis, the bladder pain syndrome, and even incontinence. And then I'll make you an offer. And you can get a free ebook on my website that will help explain more about my work and what is so different about my work that you deserve to understand if you want to get out of the misery of living with an interstitial cystitis or overactive bladder, because you can now with a different understanding. Let's take a listen to what Bryan has to say first, and then I'll come right back and I'll explain to you a whole new way of understanding what causes interstitial cystitis and overactive bladder, and a whole new way of understanding how you can actually really finally rid your bladder pain condition. I'll see you on the other side.
I don't know how to describe it, it's just I'm getting my life back thanks to you. So
awesome. How many times before you came to my clinic, how many times in a day did you have to go to the bathroom in 24-hour period?
I would say 25 times a day.
25 throughout the whole day and night? Yeah. And how long did you have to go? How many months were you going to the bathroom 20 to 25 times in a 24-hour period? And that's every single day? Yeah,
every single day, for a whole year. It was, whole year. But now it's gone down to, I'm going to say, 10 times, and I'm drinking a lot more fluids, so it's improving a lot,
And you've been to, which doctors did you go to prior to coming to my clinic?
I've been to a urologist, a gastrointestinal doctor. That was pretty much it. They told me there's nothing they could do.
Your bladder pain, the bladder spasm feeling, how much had it reduced, you told me?
60 to 70%. 60
to 70%, less pain in the bladder?
Yes.
And that pain, was it only when you were going to the bathroom you had that pain, or was the pain that would happen anytime, even without going to the bathroom?
Even without going to the bathroom.
Bladder pain was there?
Yeah, just there.
So the amount, the severity of that bladder spasm or bladder discomfort or bladder pain, however you want to describe it, that amount of bladder pain has reduced by 60 to 70%?
Yes.
And is it always happening, that bladder discomfort?
No, it just, maybe like one day out of the week it'll feel, a little, I guess you could say stiff, but nowhere near as bad as it was.
Nowhere near. So there are days that you don't even feel it sometimes?
Yeah.
Well, isn't that just incredible? I mean, he came to me after a year of suffering. He came to my clinic here in South Florida. He had to go to the bathroom 20 to 25 times every day for a year and night for a year. His frequency of his bathroom trips have reduced by 50%. His bladder spasms reduced by 60 to 70% in their severity and the frequency of when they occur. His headaches are totally gone. His brain fog is totally gone. And the numbness and tingling in his fingertips have reduced by 90%. Even the numbness and tingling in his toes has reduced completely, gone, eliminated 100%. He's not as anxious. His father says he's not moody. And he doesn't feel the urge to go 20 minutes after he goes to the bathroom to relieve his bladder, which is amazing. Amazing. So if you'd like to be able to rid your overactive bladder, your interstitial cystitis pain, keep listening here, because I'm going to share with you a whole new way of understanding what causes your bladder pain condition, what causes your frequency and urgency, and how you can actually escape that condition and get back to a normal functioning bladder and enjoy your life once again. Because I do know from many people who I've helped overcome their bladder control disorder, I do know that there are so many people whose lives are interrupted. They can't go out to dinner parties. They can't have intimate relations with a significant other or their loved one, their husband, their wife. They can't go on certain trips they're always in the bathroom on the airplane or stopping off at different gas stations or restaurants to go and use the bathroom. It's totally interrupted their life. They can't even get a good night's sleep because they're getting up to go to the bathroom every half hour, every hour, and it doesn't have to happen anymore. So when I did my first examination with Bryan, I found several reasons why he was suffering with this chronic bladder condition that his doctors never evaluated, that his doctor never really even realized would even cause the bladder control disorder. So we're going to talk about those findings in just a second. I'll tell you right now, if you'd like, you can go to my website. I'll put the domain address, the website address right here at the bottom of the screen. And you can download on my website my free 40-page, easy to follow, quick read ebook about how I can help you overcome any pain syndrome, including but not limited to a bladder disorder. And also, when you go to this to my website and you download this ebook, there's going to be another video that comes to you in the end. At the very end of that ebook, you'll find a click here link on the very last page. You can click and it will automatically take you to a different page on my website where I describe about my work in greater detail to help you really understand what it takes to get you well. Well, let's look at and hear about Bryan's exam findings. He had certain issues with certain foods. He had to avoid these foods for a little while he followed the protocol steps that I outlined for him that he did at home. Diet recommendation, the foods he had to avoid were not what the common foods that are talked about with an anti-inflammatory diet, autoimmune diet protocol, and they're not what people commonly find online as the foods that or the only foods that they have to avoid with a bladder control disorder or interstitial cystitis. He had most of the animal proteins, including chicken, including eggs, including pork and turkey and veal and lamb, pork. He had to avoid all of those. He also had to avoid almost every single spice, every condiment. I mean, even things like basil and chili powder and oregano and garlic and paprika and salt and vinegar and many others he had to avoid. Cayenne pepper he had to avoid. He had to avoid most, but not all, but most dairy products. He also, he also had to avoid every single grain except for 3 of the gluten-free grains. He also had to avoid many different cooking oils, including olive oil, which was causing him an aggravation in his bladder. Olive oil, that's right. And also there were many different sweeteners he could not have, as well as he had to eliminate the intake of most, but not all, but most of the nightshade category of foods. Now, doing that alone, while many people have tried to do those diet recommendations alone, have helped them, but many people don't experience any reduction in symptoms with following a certain restricted diet. And the reason why is this. When people have infections, that could be in their bladder sphincter, that could be in their bladder, even if it doesn't show it on a cystoscopy or doesn't show it in the urine exam. You can have an infection in the bladder, you can have an infection in the bladder sphincter, you can have an infection in the nerve, the pudendal nerve that goes down by the genital area and the bladder area in men and women. You can also have infection that's in the ureter tube from the kidney to the bladder. That ureter may be infected deep inside the tissue where it doesn't show up in the urine, it doesn't come out in the urine stream. You can have infections and chemicals that have gotten into your kidneys. And now, here's where it really, this work really shines, is that there are parts of the brain and parts of the brainstem which control the kidneys and the bladder these parts of the brain and brainstem can be infected, and they can have toxins in them, which have caused these areas of the brain and brainstem, which control the bladder muscle and the bladder sphincter, which can cause these tissues to go into spasm. And it feels like the bladder is filling up so quickly because the bladder is in spasm. It feels as though the bladder is hurting with urination or without urination. You feel like you have to go so often to the bathroom. The urge is incredible because the areas of the brain and brainstem that control the bladder muscle are infected and toxic, and they're causing that bladder to constrict so much so that the bladder can fill up with fluid very quickly because it's in a much smaller constricted state. But also the bladder may not be filling up so quickly, although it feels like you have to go so urgently every 20, 30 minutes or every hour to the bathroom because the bladder is in spasm even though there's very little fluid in there. Some of you may realize when you go to the bathroom and you relieve your bladder, there's only a few drops that come out even though it felt like it was a full bladder. That's because the bladder's in spasm and it feels full, but it's not. It's just like if you did some exercise with bicep curls or push-ups or any exercise, and you got to the point where you did so many repetitions of that exercise that your muscle was in spasm and was burning. Well, the same thing happens in the bladder and the bladder sphincter. They can feel a burning. They can feel a pain, a spasm, an urgency to go to the bathroom. Very frequently that can happen because the muscle tissue, the sphincter and the bladder muscle is in spasm and it hurts and it feels full, just like when the muscle, like a bicep or the chest doing push-ups or bicep curls, can make your muscles burn and feel pain, and even pain after, the day after, 2 days after you did your exercise. So it is very common when the brain is stressed, and I'll tell you some findings with Bryan that helped him get incredible relief so rapidly with my work. It's very common that when the brain is stressed, the bladder is stressed. Get rid of the stress from the brain, and that relieves the stress the brain sends down to the bladder, and the bladder spasm goes away, and now you don't feel the bladder pain anymore, and you don't have the urgency anymore. And I will tell you also, before I tell you these findings, you can watch on my website. I have a bladder, interstitial cystitis, and an incontinence page on my website. I've helped people overcome where they had to, even an adult woman peeing in bed every 30 minutes for 10 years, went away with one protocol that I prescribed her. I found that his bladder sphincter, he had the cryptococcus fungus in there. His bladder sphincter also was infected by the aspergillus fungus. His bladder sphincter was infected by the histoplasma fungus. His bladder sphincter was infected by the group B streptococcus bacteria. I found also that part of his brain stem, the brain stem area that helps to regulate the bladder, one part of the brain stem, I should say, that helps to regulate the bladder, is called the reticular formation. I'll show you a picture of where that is in the brainstem. And no, I'm not here to turn you into a doctor. I just think it's very important for you as the patient to become more informed about your brain and your body so you can make the right decision and know what needs to be done to help you get better. Don't just depend on the urologist. Don't just depend on any pelvic floor supposed specialist to help you get better, because most often they're missing the mark in what it takes to help you get better. So I found that in this brainstem tissue called the reticular formation, he had the group B streptococcus bacteria. I found in another part of the brain that has a bladder control center called the pons, P-O-N-S, the pons. He had the group B streptococcus bacterial infection in there. I found his bladder was infected with the group B streptococcus bacteria. I found an area of the brain called the cortex. It's the outer part of the brain that controls the whole body, including but not limited to the bladder. The cortex of his brain had infection from the group B streptococcus bacteria. It had infection from influenza virus, and no, you don't have to feel a cold or flu-like symptoms or fever or chills when you have the influenza virus in you, the flu virus. That was in the cortex of his brain, and the area of the brain that controls the bladder muscle also, called the cortex. He also had arsenic in this cortex area of his brain. He had 6 different chemicals, 4 of which are in the pesticide groups. One is the weed killer chemical, Roundup chemical that was in the brainstem, as well as herbicide chemicals. They all cause stress to the nervous system. Those are all poisoning the cortex of his brain. Cryptococcus fungus was also in the cortex of his brain. The meningococcal vaccine chemicals were stressing the cortex of his brain. dental amalgam chemicals were stressing the cortex of his brain. I found also his kidneys were infected by the Streptococcus bacteria, as well as having 6 different poisonous pesticide chemicals and herbicide and Roundup weed killer in his kidneys as well. His ureter tubes from the kidney down to the bladder were infected with the Group B Streptococcus bacteria. And I also found that his thalamus, an area inside the brain, I'll show you a picture here, the thalamus, which also helps to regulate muscle control, which includes your bladder and bladder sphincter, muscle and sensory control to the entire body. His thalamus had mold in it. And one more finding from the initial exam, his urethra, the urine tube that the urine goes through, had mold in it. He followed that protocol. That protocol took a total of 70 plus days. I saw him in 80 days after he started that protocol. And he came back to me, again, will report, he increased his fluid intake by 50%, and he decreased the number of times he had to go to the bathroom by 50%. The numbness in the toes were totally gone. The numbness in the fingertips were totally gone. The tingling in the fingertips remained. His bladder spasm pain was reduced by 60 to 70%. His anxiety and mood disorder totally disappeared. His headaches totally gone. And his brain fog totally gone. Well, we wanted to reduce more of that bladder frequency because 10 times a day was still too much for him to go. He didn't have the urge every 20 minutes anymore. In his second visit, which I'll see him again after this protocol, his second visit was March 26th, which was 3.5 months after I first saw him. I found that the area below the stomach called the pyloric sphincter, which understand any organ in your body can refer pain and symptoms going up and going down. So a problem in the stomach can go to the brain, and the brain can be stressed from the problem in the stomach. The brain can stress the bladder. Okay? Anything, any loop of symptoms, any loop of symptoms and pain disorders and issues can happen in the body because one tissue is stressing one tissue and stresses another tissue. So I found the pyloric sphincter, the base of the stomach, had parasites and multiple candida infections. I also found that he had gas from cooking system, from the stovetop, gasoline stovetop that has flames that cook the food, as well as the gas fireplace, as well as the gas grill, as well as eating in restaurants where they cook foods with gas. Well, the gas chemicals, which have mercury off-gassing, mercury vapor from that gas, from the cooking, which is in the food and in the air, that gas was in his brain and his kidneys. We got those out of there with these highly effective and safe energized liquid drops. The pons of the brainstem that controls the bladder muscle also had the gas in it. I also found that the arteries in the brain had candida affecting them. An area of the brain that controls muscle tone, including the bladder, but not just limited to the bladder, called the diencephalon, had mold in it. And just to limit the findings here that I'm sharing with you, his spinal cord had some fungal infection as well. So when he takes these highly effective energized drops that some people like to call remedies, these, which are made in my laboratory here to provide the patient a very customized, unique customized protocol, healing protocol, when he takes these remedies, I expect that his rest of the urgency of 10 times a day is going to be greatly reduced. Maybe he'll only have to go 5 to 7 times a day, and his life will be totally back to normal. And the spasm, which was 60 to 70% reduced, is probably going to be at 100% reduced, and he has no more of those symptoms of his interstitial cystitis or bladder pain syndrome. It should totally be gone after this protocol. Furthermore, I'll report to you that the foods that he was sensitive to in the first visit when I did that food exam with him, which is not a laboratory that I order from outside. And by the way, you can learn more about my food sensitivity testing that's very unique in my clinic on this page. I'll put the link here at the bottom of the screen. You can go to that page on my website. You can also look at my unique dental examination and dental understanding of how the teeth are connected to certain pain syndromes, including, but not limited to, bladder pain disorders and overactive bladder interstitial cystitis. Go to this page right here on my website about my unique dental connection, my dental exam, to understand if you have a dental connection to your bladder disorder. He didn't have to anymore he didn't have to avoid these foods anymore. When I evaluated him again at the end of March of 2021, I found that most of these foods that he was sensitive to in the beginning, that he avoided for 3.5 months, he did not have to avoid those anymore. He's already getting back to enjoying some of the foods that he was restricted from in this healing program. Now I'll tell you, you've got to have, as a physician, we've got to have a very unique understanding of all parts of the body. We've got to be able to understand how the brain and the nervous system and the blood vessels and the lymph and any organ can also cause an insult and a stress to the bladder and make the bladder hurt, even though on a cystoscopy or any other kind of test that your urologist or a nephrologist or any other type of doctor can do with you to find out about your frequent bladder disorder or bladder pain syndrome, we've got to understand much more about it, because there are areas of the nervous system that can and do cause bladder disorders. And unless the physician you're going to understands how to evaluate your nervous system and understands how to evaluate other organs in your body and see how the different loops of stress are happening from the stomach to the brain to the bladder, for example, unless a doctor can understand it and figure it out for you and can do more for you than just running a cystoscopy or a urine exam, then you've got to find another doctor like me. And that's what I'm offering to you in this video, is how to see your bladder disorder in a whole nother way, and proving to you, again, it's not me making the statements about his relief. I'm only repeating what he has told you, his own happy testimonial of his results under my unique care. He is reporting to you about his relief. Okay, and he's very happy, like other people who come to my clinic. So I invite you into my clinic. I will tell you right now that insurance does not cover the work that I offer. This is something that would be an investment in you by yourself to help you overcome your condition, and overcome it you can and will. It might take longer than what happened for him. Everybody heals at a different pace. What you and I don't know now is how many different tissues of your brain and parts of your body that are affected and infected and are toxic that have led to your bladder control disorder and bladder pain disorder. But when we can start to unravel all these different infections and chemicals that have gotten into your body that have made this happen to you, you can and should get better. That I expect. I only hope for you it's going to be a very rapid recovery, because I love sharing with the world these amazing recovery, happy testimonials that people share with me to share with you. I love it. So the more that you can see from me, people who've gotten better, the more you can understand it is possible for you to get better. There's not just a lucky chance that somebody had, a lucky outcome. It's because there's a definite approach in helping you understand and figuring out what's causing your condition, help you remove those causes so you can get better and totally reverse your bladder disorder and get back to feeling and functioning normal. That's for sure. You should go to my website and look around at my website. I've got a lot of information there. It took many months and years really to prepare the information that I put on that website, many months to create this website. I look forward to helping you. And all the frequently asked questions are also on my website. I'll put that page of the FAQs, or frequently asked questions. I'll put that underneath this video as well, because the information about where to get a hotel and the airport where my clinic is located, the cost of the exam, the cost of your first visit, and all of that is described in great detail, elaborate detail on my website. So I look forward to helping you get well. You can get better. If anybody doubts you can get better, it's because they don't understand what it takes to get you better. If any family member or friend thinks that this is too good to be true, have them read my information. Have them watch this man, Bryan, speak about his recovery, and go to my website and watch the video testimonials of other people who've gotten better under my care also. You can get better. I look forward to helping you now. The time is now. See you soon.
I don't know how to describe it. It's just I'm getting my life back thanks to you. So
awesome.